There are new developments in the treatment of an aggressive form of breast cancer. We're here today with Dr. Michael Danso with Virginia Oncology Associates to talk more about triple-negative breast cancer. Dr. Danso, thank you so much for joining us. Can you start by talking to us about what triple-negative breast cancer is?
Sure. So there are many different types of breast cancer. One subtype is triple-negative breast cancer, which comprises about 20% of breast cancers. It's a more aggressive subtype of breast cancer associated with a worse outcome. It typically presents at a younger age, and it's more common in Black and Hispanic women. It's also more common in patients with genetic breast cancer, otherwise known as BRCA cancer, and appears to be more common in the Hampton Roads region.
How different is this breast cancer from other types?
So the two other main types of breast cancer include estrogen receptor positive breast cancer, which is the most common subtype of breast cancer and typically responds to anti-estrogen therapies such as tamoxifen. A second type of breast cancer is HER2 positive breast cancer and is characterized by the expression of the HER2 protein on cancer cells. In triple-negative breast cancer, there is no estrogen receptor protein and no HER2 new protein, so there are limited treatment options, and most patients with triple-negative breast cancer are treated with chemotherapy.
We know that there's some new hope, though, some new treatments available. Can you talk more about that as it relates to those with triple-negative breast cancer?
Sure. So here at VOA, we've been involved and led many trials for patients with triple-negative breast cancer. Perhaps the most promising agent that we have right now are checkpoint inhibitors. And checkpoint inhibitors have shown promise in metastatic breast cancer and have also shown promise in early stage breast cancer. These are immune therapies that stimulate the body's immune system to fight cancer, and they include drugs like Keytruda and Tecentriq. So although triple-negative breast cancer is an aggressive disease, clinical trials of exciting and effective new agents done here in our local community are greatly improving outcomes for all patients with triple-negative breast cancer. Really, I'd like to take the opportunity to thank all patients and families here in Hampton Roads that volunteer for these trials. Progress in breast cancer would not happen without you. I also want to thank the nurses and research staff that help take care of these patients. Finally, it is important to thank our colleagues at EVMS and Centera that collaborate with us in these trials. Management of cancer is a team effort, and everybody has an important role to play.
Where can people go for more information if they have questions about the treatments that you've discussed?
Patients can come to our website, virginiacancer.com, to get more information.
Dr. Danso, thank you so much for your time.
Thank you.